Hi everyone, and welcome to Module 2, Person-Centered Dementia Care. In this session, we'll explore how to see the person behind the disease and how our care can truly make each day better for someone living with dementia. So, what is person-centered care? It's a philosophy that focuses on the whole person, not just their diagnosis. It means understanding who they are, their story, values, routines, interests, and abilities, and providing care that honors all of that. Instead of seeing what's lost, we focus on what remains and what's meaningful to them. Words matter too. We always say a person living with dementia instead of a dementia patient. We talk about current abilities, not limitations. This language shows dignity, respect, and reminds us that every person still has purpose, preferences, and feelings. A person-centered approach brings many benefits, not just for the person with dementia, but for caregivers too. Residents often experience fewer behavioral challenges and less need for medication and a better quality of life. For caregivers, it leads to less burnout, more satisfaction, and stronger relationships. Let us look at the 5 core areas of person-centered care. Get to know the person, learn their story, hobbies, and personality. Even in later stages, connect respectfully. Connect in the moment, respond to the person's feelings and reality. If they believe something different, use gentle validation instead of correction. Engage in meaningful activities, turn daily routines into purposeful experiences. Folding laundry, watering plants, or listening to favorite music can all be meaningful. Focus on the relationship, build trust, work with the person, not for them. Small moments of kindness go a long way. Create a supportive environment. A calm, familiar space and a caring team make a big difference. Good communication among caregivers is also essential. Share what works well during shift handovers or team meetings. When we pass along helpful details like how someone prefers their coffee or what music soothes them, it helps everyone give better care. As dementia progresses, needs will change. Be flexible. Observe what helps and what causes distress. Adjust your approach with patience and teamwork. Collaboration with coworkers and family members helps ensure that the person's care plan always fits their changing needs. And remember, to give good care, you must care for yourself too. Take breaks, ask for help, and manage stress in healthy ways. When you care for yourself, you have more energy and compassion to care for others. Here's an example. Tony is watching his favorite TV show when it is time for his shower. Instead of insisting, you ask, "Tony, would you like to finish your show first?" That small act of respect builds trust, and that is what person-centered care is all about. In summary, person-centered dementia care puts the person first. By getting to know them, respecting their choices, building relationships, and creating supportive environments, we help them live with dignity, comfort, and joy every day. Thank you for your dedication and for making a difference. See you in Module 3, Assessment and Care Planning.